like contributing any like personal anecdotes or experiences as we go through these topics, that would be super helpful, because the one thing that's consistent about pregnancy is that it's different every time and it's completely inconsistent. Every pregnancy is different, even for the same person. Every subsequent pregnancy can be wildly different. I know very few people who've had very similar pregnancies between their subsequent children. So it's pretty much guaranteed, I would say 100% likely that you will have a pregnant client at some point, unless maybe you're specializing completely in geriatric massage. I would say it's still the likelihood of working someplace, whether that is a spa or a chiropractic office or at a gym, you're going to have a pregnant client, and we want you guys to be able to give them a delicious massage as safely as humanly possible. There is some disagreement between massage therapists and their comfort levels and their beliefs about when is safe to perform massage, especially during the first trimester. I personally will perform pregnancy massage from conception onward. The first trimester, I think, is totally fine as long as mom is totally fine, and as long as there aren't any contraindications or history of miscarriages. Some people, like Charisse, don't perform massage during the first trimester. She just feels like it's a little bit more of a risk, that she doesn't want to be inadvertently, perhaps blamed if something goes wrong. I have not ever heard any stories of a massage therapist being blamed for a miscarriage or any other problems during pregnancy, but I suppose that it is possible. Zephyr, have you ever heard of anything like that?
No.
So, and I also know some massage therapists who absolutely won't do pregnancy massage at all. If their client that they've been seeing for ages comes to them and says they're pregnant, they don't do the massage that day and they refer them to a therapist who will do pregnancy massage.
If I could just add, while I've never heard of anybody being blamed, just in case you're not aware of it, miscarriages are super, super, super common. And so even though I don't think massage can really cause them, you might just want nothing to do with that, all of the emotions that would go through if a pregnancy is not carried to term, even if you're not responsible for it. So.
Thank you.
Yeah.
Also keep in mind that not every pregnancy is necessarily a joyous occasion. Due to whatever life circumstances, certainly a majority of them are a joyous occasion, but you can't assume that your client's pregnancy is a fantastic thing that's happening in their life. It can be fantastic maybe later, but right now it's super stressful. The circumstances behind it may be traumatic or negative in some way. We don't make assumptions. If your client seems excited, you can seem excited for them. If they don't seem excited, don't make a big deal out of it. Just kind of match their affect when it comes to how they're feeling about things. Sometimes people will not feel super great about it at first, and then later on their attitude changes depending on how they're feeling, and giving some time to kind of come to terms with their pregnancy and what the future holds. That said, I love pregnancy massage. I absolutely love pregnancy massage. Moms need to be well taken care of, and this is an easy way to do it. Typically, the pregnancy massages that, well, I've done them in a few different circumstances. But most recently, since I'm working at a chiropractic clinic, I'm working on pregnant moms who have also either been in a car accident while pregnant or who are recovering from a car accident and then become pregnant. So my pregnancy massages that I have done most frequently are a combination of relaxing pregnancy massage, but also a significant portion of treatment work, which is not as delicious as I would like it to be, but I do my best. We want to keep everybody comfortable and safe. Any questions so far? Okay. So let's go ahead and start talking about the benefits of pregnancy massage. There are a ton of benefits both for mom and for babies. They include reduced stress, reduced anxiety, sleeping better. That's probably the one that I encounter the most. And all throughout the pregnancy, with sleeping better, improved mood, relieving headaches, sometimes congestion that can happen during pregnancy. Some women develop allergies during their pregnancy, and massage can help with that sinus congestion. Decreased low back and leg pain. That is a significant problem throughout the pregnancy, usually in the later months. Decreased joint pain, decreased swelling in the feet and legs. Some women will also swell in their hands and arms. Reduced varicose veins and varicose vein pain, and just general relaxation. So we're going to go over, yeah, Kat.
So yesterday, I remember the question said varicose veins is a contraindication. So I was wondering.
It's a local contraindication.
Okay.
So if you notice that somebody has, does everybody know what varicose veins are? They're like dark purple, sometimes little swollen looking veins that you'll usually find on people's legs. They can be, some people don't have any pain, but sometimes it can be quite tender, and we just work around it. All right? Massage is particularly helpful, yeah.
Sorry, maybe you're going to get to this, but I'm curious if you were just going to do massage on the back sideline, or however we're going to do it, would that also promote healthier veins?
Yes.
In the legs still?
Yep. The improved circulation.
Awesome.
Yeah, for sure. I always try to, even if I'm just doing a treatment massage, even if it's just for something like whiplash, I always try to at least get low back, glutes, and hips involved because almost everybody has low back pain. But it's always fantastic if you can include the legs. The massage, I'm sure you saw it in your book and in the other parts of the module, the outcomes for labor and delivery are much improved with moms who have gotten regular massages versus moms who have not had massage. And also for the infants thriving after birth, their outcomes are much improved. And that's not including infants who also have infant massage performed. That is a different thing that we need more education in order to perform, but we'll get to that. Any other questions? Yeah.
I saw that pregnancy massage can speed up labor by roughly 3 hours. How?
Usually through the relaxation. Okay. So stress and anxiety and fear will slow down your labor significantly. And that's what I do as a... Yep, everything just kind of clenches up and it can stop completely. And that's part of my job as a doula. If you don't know what a doula is, I'm a birth doula, so that means that I am a support person who works through labor and childbirth and a few hours afterward. There are also postpartum doulas. Postpartum doulas help with things like lactation. They'll watch the baby while mom sleeps. They'll do laundry, make meals. They just kind of come in as a helper and caretaker for the parents and the baby. I had something else I was going to say about that, and I can't remember what it is. We'll come back to it. Pregnant clients should have doctor's clearance to receive massage, just for everybody's safety. You're going to do your intake and you're going to, make sure that things are, yeah.
Do you need like a note from the doctor, like documentation stating that, or can you go off the person's verbal authorization?
I would err toward the side of receiving a note.
Okay.
Sometimes in very early pregnancy, like you may find out that somebody's been pregnant and didn't know it.
Mm-hmm.
That, of course, there's nothing that anybody could have done
Sure.
to know for sure that that was safe. My exception to that is a mom who has had several, at least one other healthy, normal pregnancy without any contraindications or no high risk factors. Usually those moms kind of know what to look out for. I wouldn't necessarily, consulting a doctor is always a fantastic thing when you're working with moms and babies.
Okay.
So I would err on the side of caution. All right.
Can I add a little to that?
Yes, please do.
And, healthy, safe, low-risk pregnancies can change and have some hiccups along the way.
Mm-hmm.
It might be minor hiccups, or it might be situations that all of a sudden mom's needing to be on bed rest, or even an early delivery, like a situation with eclampsia or preeclampsia. So these are the kind of things where, you want to make sure that with their doctor, everything is being monitored and safe, or whoever their healthcare provider is for their pregnancy. Many massage therapists also take blood pressures, and this would be a good time for that, to make sure that mom's blood pressure is not spiking.
And this isn't just like a one and done intake and you find out everything's fine at the beginning of the pregnancy and you never ask again. Things change rapidly and week by week. So every time your pregnant client comes in, you just want to check in with them, make sure that nothing has changed, nothing's come up, that they may have been nauseous last week and this week they're not nauseous but they have heartburn. Things change rapidly and continue to evolve, and you just really need to play it by ear throughout the entire pregnancy. And sometimes there may be circumstances where you are the only person who knows that they're pregnant because they have revealed that in intake, but they are waiting to announce it until usually people wait 10 or 12 weeks before telling strangers or the rest of their families. So there have been some circumstances where I'm the only one who knows.
Can I answer that too?
Yes.
I'm walking over here to be in the video, but I don't think I'm actually in the video when I walk over here.
Go out of skeleton.
You are.
So a lot of women don't tell a lot of people in their first trimester. There's a lot of reasons for it. It might be family, as Elizabeth said. It might also be their work. So while we respect all clients' confidentiality, we want to be especially careful that this doesn't come up in, say, you run into a client at church or a protest or any kind of social event, you do not ask about their pregnancy. There might be people around who are unaware of it.
It's kind of like that social rule that you never ask a stranger if she's pregnant, because she might not be, unless you see the head. Don't assume that somebody is pregnant. Kind of same vibes, right? All right, so the considerations for pregnancy massage that you don't have to think about as much during regular massages are things like pregnant women run warm. I've only met, I think, 1, maybe 2 pregnant women who felt they were still running pretty cold during their pregnancy. Most moms are running warm or hot. So I try to keep the room on the cool side, and I don't turn the table warmer on. If you have a mom who requests the table warmer to be on, that's okay, but you can only do it up to about body temperature, not hotter than that. You don't want to raise their temperature. It's the same reason why pregnant moms are not supposed to be in the hot tub. It raises their temperature like a fever would. So we want to keep them warm and comfortable, but not uncomfortably sweaty, and we're not raising their temperature. Pregnant clients will most likely have to go to the bathroom a lot and more frequently as the pregnancy continues. Some women don't feel like that kicks in right away. And I know some women who, were only a few weeks pregnant and already they were peeing constantly. So it really depends, but it's always a nice thing if you can give them an opportunity to pee before their massage and also after the massage, and have a plan in place in case they have to pee during the massage. Whether that means having, a robe that they can throw on and make a run for it to the bathroom, or wrapping themselves in sheets and just, keeping a lookout while they run for it. I very rarely have to do that. But just give them the opportunity, because nobody can relax during a massage when you have to pee. It sucks, and we want to keep these moms as comfortable as possible. The key to a comfortable pregnancy massage, as you guys might have assumed, because we asked you guys to bring in 10 tons of pillows, are using bolsters and pillows. We're going to create a cozy little nest where every part of their body is well supported, so that they can fully relax, even side lying. Semi-reclined, people know how to relax semi-reclined, but sometimes side lying is a little bit more difficult to really relax into it. And the whole point of all of the pillows and bolsters that we use is to try to keep their alignment as straight as possible, so that we're not, they're not like kicking a hip up. We want to make sure that they're, not like twisting. We don't want to be creating more problems by having them in a weird twisted position while they're on the table. We want them aligned, comfortable, be able to, really let their limbs be heavy. And we'll get to more positional things in a minute. I know some people mentioned this in the discussion in the module, but try to avoid water sounds in the massage or pregnancy massage. Some people love to have trickling fountains and classical music, but it just makes you have to pee. So be kind. Don't have water sounds. Side-lying massage can make it so that your own body mechanics change significantly. So, we're going to experiment in the lab, and I would probably start at your usual table height, but it may be that when you have someone sidelined, you need your table higher or lower. Lots of times I will have a lower table, and then if there are times that I feel like I need just a little bit more leverage, I will sit for that. It's great to stand, especially doing glute and hip work, but if I really want to get into like the erectors, trying to work bending over can be really fatiguing after a while, and it shows in the quality of your touch, how uncomfortable you are. So being able to get a decent depth and pressure, sometimes that requires you to, maybe you need to kneel or squat or sit just to be able to make that work. And your own positioning may change as the pregnancy continues. It's always nice to have water and tissues handy. Pregnancy makes you thirsty. Every pregnant woman, every pregnant client I've ever had comes in with an enormous water bottle. But it's always nice to have some water for you to offer. And also, because of allergies, because of congestion, having tissues handy is really nice. I mean, you should have tissues anyway for everybody, but especially for pregnant moms. Having ginger candy or peppermints on hand, it's a nice touch, especially if you're going to specialize in pregnancy massage, to have those things available. If somebody has been vomiting frequently and unexpectedly, you're not going to want to have them in for a massage, and they're probably not going to want to get a massage because nobody wants to throw up in public. But if it's just like a minor kind of nausea, having some things on hand can make the massage much more comfortable, because that nausea is very distracting. Zephyr, do you have any differing opinions about nausea versus frequent vomiting with pregnancy massage?
I agree with you that, women will come in pretty often with just nausea. That's super, super common. And a lot of times, as long as you just don't have scents in the room and no jostling, you can help them, and some acupressure points. But it is unlikely that they would come in when they're actually frequently vomiting, because, nobody wants to vomit in public.
Yeah. And Zephyr brought up a good point. Jostling, shaking, it's not recommended during pregnancy. Also, and we'll get to it more in another slide, but some scents. I try to keep my massage room as scent-free as humanly possible, just because I work with a lot of people who have chemical and scent sensitivities. With pregnancy, you can have a scent aversion to something that you used to love. It can be, I've known people who have a serious aversion to the smell of milk. Sometimes, like the scent of coffee. Sometimes it'll be, like essential oil kind of smells. It can be completely random, and that can also change throughout the pregnancy. So sometimes people will have a scent aversion in the first trimester, and then by the second trimester, they don't have any scent aversions, or maybe they have a different scent aversion. Has any of the parents in here had like scent sensitivities? Lacey?
Oh, do you want to know about it?
Yeah.
That's actually, I never have had it, and I haven't had it since, but just the smell of perfume, anything really strong, I guess, would make me vomit.
Yeah.
I shared it on the discussion, but it was kind of cruel, because the scent of coffee made me so sick, and normally I love coffee.
Oh, that's hard.
That sucks. Anybody else want to share?
Can I say something in the opposite direction too?
Yeah.
Women, as I'm sure many of you know, also often have a lot of cravings, or sometimes nibbling on food is the only thing that takes away their nausea or gives them any relief. And so I was going to a chiropractic clinic when I was pregnant, and the people behind the counter were having a party with like all of this chicken and all these delicious smells and foods that they were not sharing, and it was torture. So I would say don't eat around your pregnant women. Not that you should really have food in your office anyway.
And some people will bring in like snacks. Like I've known a couple pregnant women who will bring in like saltine crackers just to keep the nausea at bay, because they want to have a little something in their stomach all the time, or else they start to feel like they're going to barf. Some women have a lot of like faintness, and that can have to do with blood pressure issues. There is a condition called syncope, where women will just randomly faint during their pregnancies. I have a friend of mine who had that with all 4 of her pregnancies, and she fell down the stairs a couple times and ended up in the hospital because she would just pass out. I think you guys are asking me to spell things. I think that's how you spell it.
That makes sense now.
Syncope.
Yeah, I was trying to picture it.
But it can also have to do with blood pressure issues. So things like laying down and then having to get up again. You may just need a minute to kind of let your head stop spinning before you can actually like get up and get dressed. I try to give my pregnant clients a little bit of extra time just so that they can, transition safely to being able to stand, and also sometimes they need a little extra time to get dressed. Especially if it's earlier in the pregnancy and they're still wearing shoes with ties and they haven't transitioned to slip-on shoes, they may need a little extra time.
I guess that those 2 things, that's probably occurring in a lot of other situations too, right? Like, my roommate has a heart murmur, so she can't like get up and down very quickly, or she'll just pass out.
Yep. Yeah, that's common.
But she's like 40, so it doesn't appear to be anything weird,
Yeah, and that can be common for people who aren't pregnant. Sometimes that's a side effect of medication. It's always nice to offer assistance getting on and off the table if people need it. Having a stool to be able to hop up onto the table, or to have it to put their feet on to steady themselves when getting down is also nice to have. Did you have something to add, Zefire?
This is also very common with seniors.
Yeah.
And it's called orthostatic hypertension for people who, when they lay down a while and then they get up or change positions, that they feel faint.
Yeah.
I have it's a little off topic, but I'll probably forget if they don't ask now. With the side lying and draping, I was curious, because like in that picture example, like she's covering her chest with her arm. Is that acceptable? Like, because technically you're supposed to be draped at all times, right?
Our draping that we do here for side lying is very modest.
Oh, okay.
And I'll do a demo today, but we keep it really modest. So you would not be, like in this picture, covering your own breast with your arm. Nor do I advise performing massage on someone's pregnant belly, just because there's not really a whole lot of need for it. And also, some people just really don't want anybody to touch them there. It feels vulnerable, it can feel invasive. I just avoid it. There's no real need for me to be massaging someone's pregnant belly.